So thank you so much for joining us today. And if I can start by asking you to introduce yourselves. So maybe, because you're all in a different order probably than the one I can see. If we go to my top left, which is Suba, would you mind introducing yourself, please?
Hi, my name's Suba Dickinson. I'm the Director of Curriculum at Harrow College.
Thank you. Debbie?
Debbie Robinson, supported employment provider, Kaleidoscope Sabre.
Very much. Steve?
Hi, I'm Steve Parr, support employment provider, the other half of the Kaleidoscope Sabre partnership.
Excellent, thank you. Bambi?
Hi, I'm Bambi Garmi. I'm the Wyton Participation Lead, but also the business liaison for Northwick Park Hospital.
Thank you. Goretti?
Hi, I'm Goretti Dowdican McAndrew. I'm Head of Multiprofessional Education and Development at London North West Healthcare. I'm part of the partnership at Northwick Park site.
Super, thank you. And Emma?
And I'm the job coach at Northwick Park, and I work for Kaleidoscope Sabre.
And perfect timing, Tafina. We're just introducing ourselves on camera, so if you wouldn't mind introducing yourself and where you're from, that would be awesome.
I'm Tafina Davidson, and I'm the project search instructor. I work for Harrow College.
Thank you. And my name is Claire Cookson. I am the CEO of DFN Project SEARCH. And so I guess I'm going to ask Debbie, can you just introduce this site, how long it's been running, and how many interns you had on programme for the 2019-20 cohort?
So we're at Northwick Park Hospital in northwest London. This is our third year. We're just recruiting for year 4, which has happened this week. And this year we've had 10 interns. Yeah.
Thank you so much. So I guess my first question goes to Emma, Tafina, and maybe Debbie and Steve. How did the interns cope when they had to leave the hospital because of the lockdown arrangement?
Shall I start?
Yeah.
The others can join in. So we've been watching the government briefings and listening to what was going on, and unfortunately Bambi was stuck in India, although she was still keeping in contact even though she was in India. But Goretti came down to the base room at least twice a day to keep us up to date with what the trust's decisions were and how things were kind of moving forward. During that period we had a contingency plan for either a move back to the college or to move into lockdown, so we were preparing the interns for a move to the college or straight into lockdown, and we had an itinerary of all the work that they would be doing. And then we got the news, so we moved to the college for a very short period of time, got them settled there. I think we were at the college for about 2 weeks, is that right?
Yeah.
And they were continuing with their ASDAN work, and we were still kind of doing role play, preparing people for interviews, etc. And then we got the news and moved into lockdown. We had a meeting with families, we invited them in, we had conversations about what was happening, and then we kind of went into lockdown. I think we might have given them a day off to get settled, and then we started fresh on the Monday and carried on business as usual.
Day off.
Yeah.
What do you think, in terms of sort of how did they feel in all of that, kind of what was the emotional state like for interns?
I think Tafina and Emma were closer to that when they were actually in lockdown, but they've been fully engaged through, this is week 15 for us, but they've been fully engaged throughout that process. But I'll let Emma and Tafina fill you in.
Yeah, from day one they was all on board. They was ready to start. You know, they was, as it goes, they was brilliant. They have just literally taken to it. I mean, obviously there was the thing about when are we going back at the beginning, but now they're just so used to it.
I think initially they did struggle. Some of them struggled, which is understandable because it happened so suddenly and they were not used to working remotely and working in that way. We're very hands-on with them, so they were used to us physically being there, you know, and they felt comfortable. They felt comfortable knowing that we were physically there every day to support them. So it was a bit of a challenge for them. Some adapted really well. Some, it was a bit of a slow process, but as Emma has said, ultimately in the end they've all adapted and they've all, you know, risen to the challenge really. But initially there were a lot of worries because they didn't know if they were ever going to be able to go back to the hospital. They didn't know what you know, the virus would mean to them personally. So we had to have a lot of discussions with them and do a lot of reassuring them. and they had to learn a whole new way to work, really. So it was kind of like going back to the beginning and taking really small steps with them to teach them new ways of working.
Yeah.
I think it's worth stating this point though, Claire, that the team worked so closely with the interns that whilst there was uncertainty, there was a great deal of trust. The relationships are strong, communication was good, so they weren't left without information. Whilst it's difficult for us all, there was that high degree of trust between the team and the cohorts and the business.
And I think they was really engaged. I think from, like, although there was some, uncertainty in that at the beginning, they was all fully engaged. They was all kind of wanting to work, so to speak.
Yeah, and just hearing when you were saying about Goretti coming down twice a day and Bambi still being in communication even in lockdown in India, that sort of really helps me understand how this is a real collaboration and how the hospital think of these interns as part of your staff force, part of your network, and that feels incredibly positive.
Yeah. I think to add, Claire, in some respects, you got to recognise the context of where we were as a hospital in the international pandemic, and I think that has come very much out in the press with the BBC coverage of how Northwick Park was actually, as a site, was the first to actually have the huge impact of influx of patients, influx of COVID-19. It was a challenging time, but well managed and well controlled from a trust perspective. So it was important to keep in contact with the team, to keep them informed, even though information sometimes could have changed from morning to afternoon. So hence the briefing sessions were required on a regular basis, because it was such a fast flowing, changing environment.
Yeah. And from a college perspective, I was in contact with Goretti just to see the lie of the land and see where we were going with all of this. And behind the scenes, in terms, I think Debbie's already mentioned, we did think about contingency planning, and we sort of thought, if they do come into the college, where are they going to go? How is it going to be managed? How effective is it going to be? So it was the synergy, I think, between Kaleidoscope, the hospital and the college and the people on the ground that really, it was there's no question about it, because in the press it was all coming out, it was all new, and we could hear about various deaths are happening, and so you've got to manage the mental health of those interns as well. And so I think only in working in collaboration could any of the success that you guys have done, and they've all done, could have been achieved. You can't do it in silo. So hence Goretti and Bambi running down, just checking what's going on a daily basis, was absolutely imperative for this to be successful.
Yeah, it does sound like
totally agree.
Really well. So thinking about back to that time, were there any of your interns that went straight into a job at the point of lockdown or during lockdown? And if so, what roles did they go into?
Yeah, so we have one intern who was working in linen and laundry, was his rotation. So they put him on a temporary 3-month contract, and he worked all the way through the pandemic, 6 days a week. We had to go in and negotiate for him to take a break because he wasn't going to take a break.
I can imagine that.
So we negotiated for him to have a break, and then partway through being in lockdown, he was offered a permanent contract, and he's now permanent working in linen and laundry, which is amazing. Yeah.
And so I suppose in terms of your support for these interns during lockdown, I want to ask that from two angles. How did you support somebody who moved into a job role, and how much support did he need? And then what type of support did you offer throughout lockdown to the interns that remained on programme?
We've got several interns who are working at the trust, not just Tanesh. I mean, obviously he got his job during lockdown, but we've got lots of other interns who are here also. We've also got interns who did their project search on another site, and have got a job here too, in fact. So we just kind of keep in contact with them. We've got a very strong relationship with the managers and the mentors here. So we, particularly Emma and Tavina, would be in contact with them, just checking in, people still coming in, are they okay? Messaging them using WhatsApp and just letting them know that we're around and they can contact us. And those that were having a difficult time, just making sure that we keep in regular contact, because I think that's really important. And certainly Tanesh has valued that. And Emma actually came down to the hospital because he was struggling for a bit. So she popped in for a meeting in the car park, wasn't it, Emma?
And you're not exactly local, are you? Aren't you in East London, Emma?
I am, yeah.
Just put it out there.
What kind of stuff? What did you need to offer to him just to help him feel good about what he was doing?
I think he just because he kind of got the job and then it was like we was gone.
Yeah.
And then I think he sort of like struggled with the fact that none of us were here and he'd got this job and what am I going to do? And, you know, Tafina was talking to his parents and that on WhatsApp, and he just, I was WhatsApping him and I said, are you struggling? He said, yes. I went, do you need me? And he kind of went, yes. And I was like, to Debbie, I'm going. I did say I was going into the car park, but Bambi come to see us and Bambi's fault.
Wow. So from a hospital perspective, you've got, what I heard you saying a minute ago, Debbie, was you have mentors within your hospital, you have really supportive managers. Is that right?
Yeah. Right across the board. Yeah. Yeah. Even the facilities providers who obviously aren't NHS, that's MediRest, their managers and mentors, keeping in contact with them. We've got people working in their services. We've got healthcare assistants working up on the ward and theatre. So yeah, it was important that we have those connections. And as Suba said earlier, it's about those relationships and partnerships. If you don't have those, then we would be kind of, you know, at sea with all of this. But we have those contacts. We're able to keep in contact with people and know what's going on and how to support people.
And I guess, Bambi and Goretti, from your sort of business perspective, this is absolutely in your interest, I guess, to nurture this talent pool and make sure that you got the right structures in place to support people once they've got a job.
Absolutely, absolutely. I think you've got to remember that the needs of all the staff are very similar. They're scared, they're unsure, they're uncertain. There's no difference with the Project SEARCH interns. They have got the same fears, anxieties, and need the same reassurances. And there was quite a lot of support for staff and for the interns to access as well that could support them, like, you know, there was the meals, the free food, the coffees if they wanted, and also the wellbeing centre as well. So they could all have access to that same facilities as well to support them. So they felt part of London Northwest and Northwick Park site.
Yeah, I think that's an excellent point, isn't it? That often the support mechanisms that interns need are no different to those that anybody new coming into your organisation, coming into new roles, getting promotions. You know, it's the same level of support, I'm sure.
Yeah.
And to focus a bit on those interns that you had to start delivering the provision at home, what kind of support did you put in place for them, and what did that look like?
They could call each other. We have our WhatsApp, so they could put messages in there, and they would answer the messages for each other before we could even get to it sometimes, wouldn't they, Emma?
Yeah.
So if somebody had a question, they put it in there, and if somebody else knew the answer, they would put the response in there. So they were really supportive towards each other and towards us as well. So we all worked together. We were a team, you know, we were all in it together. They understood that, and, you know, they trusted us and worked really well with us.
And Suba, just in terms of a college perspective, what kind of value add do you think was offered to these interns, because they're part of this network and this Project SEARCH team around them, that maybe other people in the college weren't able to have that kind of level of contact with their teachers?
I mean, in terms of the college, the college was regularly contacting their learners. I mean, we did that, you know, in a really sort of rigorous manner. So we did have sort of structures in place. Where the added value is the real close relationships that, say, Emma and Tafina have with their interns, and that level of care, and also from the hospital perspective as well. and really good dialogue with parents. So there was a feeling of looking after their holistic perspective from employability, but also from a mental health state. And I think that that is the added value from that is it's almost like an extended family. So you might have Debbie ringing them up, why aren't you there? And then you've got Emma, and then you've got like what I would call a triage effect of all those three people with those learners, and that kind of, it's a very small, tight-knit community. And they did all, I'm sure they all wanted to go back, you know, desperate to go back, you know, but without that support network, they may have fallen apart. And, you know, mustn't underestimate the value of that, because it was that support that's got them through. And do you please remember that these interns, in terms of their prior history, they've had quite a difficult, it's not been easy to get to where they are. You know, it's not a typical, you know, person goes, finds a job, X, Y, Z. And for them to kind of make it through to where we are now, that in itself is remarkable. It's a feat.
Yeah, I think that's all an excellent point. And I think on that point then, when were you able to start thinking about bringing these interns back onto site?
Well, that was a challenge in itself. I mean, probably everyone was watching the briefing and thinking, when is it going to happen? And then I think it was Debbie that said, you know, they really do want to come back. I think it's time. And I was like a little bit cautious, you know, certainly from a sort of a risk assessment point of view. How effective is that going to be? And what would Goretti feel about it? Because I know that, Goretti, I remember you ringing me up, you know, when we were during that pandemic, your passion came through about your care for those interns. Like, you just wouldn't believe, she was so worried, you know, careful about how they would be. And so it was that kind of managing that process of making sure that all the partners on board. So I think Debbie and you and myself and some of the meeting met up and we talked about it, and then we talked about approaching the hospital, making sure that was right. And then Debbie wrote this fantastic sort of plan to get us through to this stage, and I'll pass over there. Yeah,
Debbie, talk us through that brilliant plan, and that plan is being shared across our network, so we are incredibly grateful. It'd be great to hear from you how you approach it.
Well, first of all, it wasn't just me. So Steve and I work in very close partnership, and we're always kind of thinking ahead, kind of preempting what next. So we have a very strong team of job coaches on the ground who keep us informed and are in contact with us every single day. So we feed off them, really. So we started the conversation and thought, okay, what does this need to look like? So because we have got such a strong partnership and we're very close in terms of the way that we work across the trust and the college, etc., we were able to kind of, they say it's maybe a bit of a cliche, but walk in their shoes. So from the intern's perspective, from the family perspective, from the trust perspective, you know, from our job coaches and the tutor, what does that need to look like? What needs to be in place for everybody to feel comfortable and safe? And that's where we started, and we literally wrote a list of things that we would need to consider. We had conversations with the interns, with the job coach, with the tutor, with the families, and then we visited that list and thought, okay, we think we've got a pretty good list of things that need to be in place. Now let's plan that. So we literally just put it into an action plan, put some dates in there which we thought might be reasonable just to get the conversation started. Had a conversation with Suba, had a steering group meeting, and then just took the steering group through the plan step by step, line by line, and there wasn't any questions, which I was quite surprised about. I think everybody was busy writing notes about, okay, yeah, we need to do that, we can do that, and then it just kind of happened. And again, as Suba said, you know, we have that relationship, we have those partnerships, and if you can understand what everybody's perspective is and you put that together, then I think that's what made it work. Okay.
Goretti and Bambi, from your perspective, from the business perspective, what was the impact of that plan? How did that help and support you?
The plan was really good because it gave us action points that we can take away and action straight away. For example, like making sure that the base room had a deep clean because it hadn't been used for a while, and it did needed a clean actually, and getting sanitizers installed. Also making sure there's enough PPE in the room as well. also carrying out a risk assessments within the potential departments that the interns are going to go back into, and having that, initiating that conversations with the managers and saying, are they happy for the interns to come back and complete their 2 months placements. We've had a very good response. Even the managers and the mentors have been very supportive and are looking forward to the interns coming back. Made sure that each parent, we met up with the parents, explained, discussed the recovery plan, explained what's going to be actioned in the trust. And at that time, we were introducing the wearing mask. It's a mandatory for everyone to wear masks in the corridors. So they've been, we have staff that hand them out at the entrances, as well as taking their temperatures and sanitizing that, letting them know exactly what entrances to come in. So even when Debbie, Emma and Steve came in, I had to instruct them to come in from the main door, because they normally use the side entrances, just so they can get their temperatures done and get their mask. So all that was put in place, and we're just carrying out, we've offered each of the interns antibody testing. So I've just booked appointments for that, which will take place tomorrow. And we'll be carrying out risk assessments as for vulnerable adults, risk assessments, part of the BAME.
Yeah, they're all done. Well, we've got three that we're doing today, but we've done 4 already. We did those yesterday evening with the parents.
Make sure all that's done before they actually come back into the hospital.
Yeah.
And did you come up against any significant barriers when you went out to the different departments to organise the final rotations for these?
I think the only barrier we've had is our other partners, MediRest. They've just had a new management structure, so they just want to get into place first. So that's where our barriers are. But we have located other placements within the hospital that the interns can go back into.
And I think it would be fair to say that with MediRest, I can totally understand that they want to embed their own senior managers first before they actually contemplate and supporting the interns, because it's not fair to put them into an area that might be a little bit unsettled because of new managers. You always get that when you get a new senior management team. So I think, it's fair that they embed that and they support their staff, so then they have the skills then to support our interns when they come in. But a lot of the risk assessments, a lot of the areas, again, I'd like to reiterate, of making sure that if they're from a BAME community, get the risk assessment for vulnerabilities. It's no different than you would for any other member of staff, and that's what the important part. You're treating them, you're respecting them, and ensuring that they are supported like another member of staff that's here in the organisation.
Yeah, really, it just sounds like such strong practice.
It's also, again, Claire, it's worth kind of re-emphasising the fact that it's about trust. So, we came into this hospital 3 years ago, and we came into 15 departments that were already open to us. And that's because Bambi had gone around and sold the programme, and she's done it again to get us back. So
mind you on my team.
Yeah, it's that level of trust. So if Bambi's saying you need to do this, then people trust her enough to think that's true. We do need to do this. So it's trust and relationships really strong here.
But I think it's also important to note that the buy-in from the hospital. I mean, I remember Goretti's words when we had our very first open evening, and it was to share with the families that what we want to do here is grow our workforce from our local community. And that's never wavered, and that's the feel that you have when you come to the hospital. This is your local community hospital, massive hospital, so much goes on here, but it doesn't feel unwieldy. It's it is a community feel, and I think that relationship, that trust has gone through right from day one with all the families that were engaged in the programme and all the interns that were engaged in the programme, and the trust has year on year recruited people from the programme, and they're all still here, all of them, which is amazing also. So I think, as Steve said, having that trust allows you to do the things that perhaps some other hospitals haven't been able to yet.
Just share with us the rotations that they're going to their final placement.
Yeah, so we've got 2 healthcare assistants, and which they were healthcare assistants before, so they're going back to complete their care certificate training. So Fran, she's amazing. She works with our interns very closely and makes sure that, you know, they do what they're supposed to do. So there's no slacking. And she was already emailed to say, when can I meet them? You know, I'm on site. She's on site today. They're not, but she's already said, when can I meet them to check how they're doing and get them set up ready to carry on with the care certificate. We've got a housekeeper role up on Johnson Ward, I think it is. So that's a kind of hybrid role, and that's one of our interns who'll be making sure that the equipment is in working order and charged, and the stock, the stock is up to date, and the room's kept clean and tidy. We have somebody working in Goretti and Bambi's team, doing data entry. We have somebody working in linen and laundry in admin, and possibly somebody working in linen and laundry, actually doing delivering the linen and laundry to the wards. Linen and laundry love us.
They do.
That would mean they've got 3 project search interns in there. Well, Tanesh is an employee now. And I forget who we've got left now. So I think we've got somebody who's going to be doing on rota, helping with the sanitising and making sure people are masked up. So customer service role, and working with one of the departments to, you know, gather patients' belongings together and make sure that they get back to the right people. Have I missed anyone?
No.
Is that everyone?
That's it.
There we go.
Yeah.
That's it.
Excellent, thank you. And so thinking also then during lockdown, you've had to think about how you recruit people for your next cohort, the September 2020 to 2021 cohort. So how have you done that?
Well, if I'll come in there because we had planned. We have quite a detailed assessment day, and we had planned it. And of course then lockdown happened, and it was like, oh my goodness, you know, what can we do? Because I'd organised the whole Zephaniah building, I'd got everything ready and couldn't do it. So we then had to kind of get our heads together. How are we going to get, because we had a long list of prospective interns, to be honest.
Over 20.
It was over 20,
places.
yeah, and now it's getting quite sought after, and you know, people are wanting to do it. So how are we going, you know, what's the conundrum here? How can we actually do this? So we did get our heads together, and then after the steering group, we had a small meeting beforehand, but then we had a steering group meeting, and we agreed that we'd have to do the interviews remotely in the first instance. Emma and Tafina had a long list of people. They spent, I think it was 3 days. I'm looking at Emma because I can't see Tafina, but was it 3 days?
4.
4 days.
So we've done it over 4 days.
Yeah, and
we're interviewing Thursday and Friday this week as well.
Yeah, we've got another 5 to go.
Yeah, so it's, you know, it's getting sought after, which is a good thing. It's a good thing. And I think 3 of those prospective interns have got hearing difficulties, and the college has agreed, if they are successful, that they would also come with a communication support worker as well. So that would be throughout the programme if they were successful. So that was left to both Emma and Tafina to kind of sort out, and I think that's gone reasonably well. Is that right, Emma?
Yeah. There were so many fantastic young people, and like you say, and even the ones that were deaf, you would think it would have been a bigger challenge, but it wasn't.
That's good, isn't it?
And you know, one of the young men just, you know, he knew what he wanted to do. He wants to do manual labour, and he wants to work.
Oh.
And you know, so
that's all we need.
You know, it was, I mean, did we have some laughs while we was doing it? Of course, you know, with a few of them, which was quite funny. But it was really, really a good experience.
That's really reassuring to hear, because actually that is a challenge you face, you know, thinking, gosh, how do we take this from something that was a very practical process, online, and then if you have communication challenges, that's, you know, an added thing to consider. So that's really reassuring to hear. And in terms of, have you organised their rotations for the next term, for the new cohort?
No,
we won't know that yet.
So we need to start with the vocational profiling, because we need to understand who they are, what they like, what they don't like, what they're interested in. And that process already started obviously with Emma and Tafina, so they'll be able to kind of feed that into the rest of us. But that's all part of the process. We've got lots of rotations that are open to us because we've got the managers and mentors ready and primed, if you like. But this hospital has never been about, we'll take one, there you go, have that person. It's always been about, well, what's the best fit? Because the business is still a business and it has to run as a business. So we can't just put somebody in there. We've got to carefully do that matching. And the interns get interviewed by the managers and mentors to see if they're a good fit for that department.
Goretti and Bambi, from your perspective, were senior leaders of the hospital always engaged, or were there any barriers that you all felt or faced?
I think from a senior leader's perspective, they've always been engaged. The project was set up with exec approval and guidance, and I think they've always been concerned and supportive of the programme. I don't think we've ever had a barrier. I can safely say that, not just publicity saying, so that is actually a fact. We've never had a barrier from the executive team. Our HR director, Claire Gore, has always been very pro supporting Project Search, and the care as well that needs to be to support them and ensure that they are looked after. I think the same can be applied from Lisa Knight, our chief nurse, and Helen Hardy, deputy director of nursing. So they've always been very supportive, making sure that they are well looked after in the organisation. I think the testimony of the Project Search interns is to say that last year in the staff awards, one of the candidates, Nafisha, actually got a Staff Excellence Award for her academic achievement to recognise what she'd done and be a healthcare assistant on one of the wards, and is now doing her apprenticeship. So actually that's a testimony of how much she worked, how much she developed, and the recognition that we give to this group of staff that are with us. And when we had Ruth May, our chief nurse, come to the organisation last November, this chief nurse asked for Lisa Knight for a collection of staff that would come and meet her from different levels across the organisation. So you had senior nurses from doctorate level, consultant level, right down to healthcare assistants, to show that it is actually a team approach. And Nafisha was one of those staff that went to that, to show that, we're staffing people from our local community. We're using people to work with us, to support them, to develop them. So I think, yes, there is buy-in from across the organisation for that.
And can I just add to that, whenever we have graduation, we have to use the biggest room in the hospital, because all the managers and mentors and who have hosted an intern come along and they speak about what their experience was like. But we also have a great many senior managers that come along to support the programme as well, which is fantastic, and that's been every year.
That really is so fantastic, and so just wonderful to hear what this amazing community that you've built within this hospital, and how the interns are such a valued members of that community. And so thinking about now, so just for the purpose of this video, to share that your interns are coming back on site tomorrow. And when do they go back onto their rotations?
On Thursday.
Tomorrow.
Just tell me a bit about, have you had to consider PPE and anything new and different for them?
Yeah. So as I say, our communication with the families and the interns is a very regular basis. So as we've done family curriculum session, where we took them through the plan that Bambi mentioned earlier. So Bambi was there, and Tafina was there, Emma and I were there, Steve was there, so that we could answer the questions from all the different perspectives and reassure them about what was going to happen. And Emma and Tafina have been having regular conversations with the interns and preparing them, so doing a refresher for the induction, so some of the training that we've had from DFN Project SEARCH around the infection control, and the hygiene aspects, but also PPE. So we've had all of those conversations, and just yesterday evening, Emma and I met with the families to take them through the risk assessments and make sure that those are all completed. And we have, when we talk about the risk assessment, again, as Bambi said, this is the same as any other member of staff. So we're making sure that, you know, it is special because we're being allowed back on site, and that's a privilege, and we recognise that with everything that's gone on and the journey that the staff that have been here all the way through the pandemic have opened their arms and welcoming us back. That's huge, absolutely huge, because that journey must have been incredibly tough for the people that were here throughout all of that. So having those conversations and reassuring the families that this is business as usual, or business as the new usual. But you know, the base room had the deep clean, we've got the sanitizer at the door, we've got sanitizer in the room, we've got gloves and masks, and everything's ready to go. We've moved the furniture to accommodate social distancing, and we've got training first thing. After the training, then they go and have their COVID antibody tests. We will do a walk through around the hospital in small groups, maybe groups of 2, just to get them reorientated and settled, and then we'll talk about what's going to happen on Thursday when they go into their rotation.
As part of that, feels to me like that very strong comms that you've had with the learners and their families throughout the whole time. They felt like they've still been on their project search internship.
Yeah. Well, they have, and you couldn't achieve where they are now if you didn't have that. It's quite a long hiatus, 14 weeks. If there was minimal contact, there would be no way they'd be ready to go. But they clearly are. That's because of that dialogue. And Tafina probably want me to tell you, they've completed their ASDAN qual.
Yeah.
You know, they've got their qualification during this time.
Yeah.
You know, how marvellous is that?
Absolutely. They're all so committed to it, really were.
The end goal hasn't changed. So we've been really consistent about the message as to why they're doing this. And it is different, but the goal, the destination is exactly the same.
I think that's a great point, Steve.
Yeah. And everybody's very clear about that. So whilst we're in lockdown, we still had the employment planning meetings. All the families attended, and we still talked about, you know, what is it that you're looking for at the end of this? We're still looking for a job, and this is what my job looks like.
Brilliant. And from a business perspective, why is it so important to you as Northwick Park to support these interns back onto placement and into jobs or into their future careers, wherever they may be?
I think it's like any student who would be on a program, any new learner. You know, you've got a break in learning, it can be difficult to go back in, and it's important that we re-energize and find what the new normal would look like. I know that's not a great phrase, but I think we have to progress. We've got to work within the constraints of what we've got at the moment. So it's important to bring them back, important to give them those skills that they can find employment afterwards when they complete their qualification, complete their experience. I think Steve or Debbie said, you know, it is about supporting our local community. Everybody, irrespective of ability, are part of that community. And it's always been my passion that we look at all skills and ability, because everybody has a place to play within that healthcare partnership, whatever it might be, because everyone is vital to making that journey as perfect as you can for the patient. Each one of us have a place to play in that, and that's what's vital the whole way through. And you've got to think about that no matter what you do.
Yeah.
Excellent. And so having them be on placement with you for a year and train in the Northwick Park way, you know, what does that bring to your business?
I think that extra breadth of knowledge. It brings experience to the mentors in the workplace. It gives them a sense of achievement that they've supported people through and got them to achieve their pinnacle of ability. And this is the start of the journey, a bit like Laetitia. This was just the start of the journey. It continues on afterwards. So I think when you talk to the mentors, it's about what they see they've achieved and they've helped this journey. So it's giving people extra skills within your workforce, not just the the learners as well. So you're broadening more than one person's experience during this, and it's also as a business feeling that you're giving back.
It's very rewarding.
Yeah, good for everyone, I think.
For everyone,
So
yeah.
I wonder now if thinking about all of our sites who are thinking about how they're going to get their interns back onto sites and how they're going to re-engage all the different partners. So I wondered, from your different partnership perspectives, could you give us your best advice, if I sort of say for education to education, supported employment to supported employment, business to business, what would your advice be around getting back from lockdown back onto rotation? So shall I start with you, Debbie and Steve, while everybody else sort of thinks?
I guess, I mean, from supported employment point of view, is understand the business. You know, you left in March. What you're going back to is probably quite different. So don't assume it's going to be the same. Find out what's important to the business. Rebuild those. If you haven't maintained relationships throughout the COVID period, invest in those relationships. Find out what people need. Don't assume it's going to be as it was, because it really isn't.
I would agree with that. I think it's also trust the partnership. We're approaching year 4 for this partnership. It's not been an easy road. It never is an easy road when you've got people from all different perspectives and staff changes, etc. But we've all worked together continuously from year 1 to approaching year 4 through all those difficult times, and there's been no more difficult time than this, and we're all still here. So we need to trust that. We need to trust that partnership and be incredibly grateful for it. Yeah, absolutely. Because it's not the same everywhere.
No, it isn't.
Super. What about from a sort of education perspective? What's your best advice?
The first thing is obviously that relationship is key. Relationship with the business, the relationship with Kaleidoscope Sabre, and keeping that throughout, so there's not a massive hiatus. So there's communication. The second thing is ensuring, from a college perspective or an education perspective, whether how effective that relationships with the interns are. That's got to be continuous, and you can't get to where you are if you don't have a real structure. So structure's absolutely the key. And the third thing is have a bit of humour, because if you have a bit of humour when you go through difficult times with your colleagues, with your interns and the parents, you can get through this. It's been difficult, it's been unprecedented, but if you have an end goal in sight and you keep that end goal in sight, and educationalists do that, you'll get to where you want. And at the end of the day, we want those internships to flourish. And by gosh, they are flourishing.
Thank you. Before I move on to our business partners, Emma, did you want to add anything?
These young people have got so much to give, and they just need the opportunity. So getting them back, for me, is fantastic, because they're going to get that shot that they deserve. They've worked hard for it.
Yeah, they really have.
So, yeah.
Thank you. And from the business perspective, Bambi?
I'd just like to say that just to keep in touch with your mentors, let them know what's going on, and keeping them informed that when the interns are coming back. That's advice I would give. Just continue having that kind of communication with them.
I think from my perspective is actually having strong working relationships with all members of the partnership. You know, Kaleidoscope without Harold, without Christina and Emma, none of this would have been possible. So it's actually having strong relationships, keeping communication channels open, and ensuring that you're engaged with each other, and that the intern is the centre of what you need to do, and that you as a service can support them of whatever you can put in place to support them to do that. So it's constantly changing. You know, it could have been COVID, it could have been something totally different scenario, but it's remembering that you're working together for one ultimate goal and one ultimate aim, and keep that focused.
No, I think you're absolutely right, and I think that's a really good point. That it could have been something completely different. There are always going to be challenges, aren't there? But
yeah,
you know, if I just end by saying we very much look at Project Search as being a team of teams, and this is what you are, and you have really illustrated this morning, you absolutely are a team of teams, and a highly effective team of teams. And it genuinely has been a real pleasure speaking to you all and just hearing all of your passion and all of your drive and determination around these very phenomenal young adults who deserve, and to Emma's point, they deserve this chance. And I think what you've shown is that is possible to get people back at this, before they finish for this academic year. And actually, it'll be so interesting to see for those interns the impact of that third, being able to complete that third rotation.
Yeah.
And what that means for their job outcomes. And again, I've been really encouraged with how much comms you've had with the families, because like we said earlier, that it could be a really anxiety provoking time for families. And you've kept them well and truly on board. And I'm so impressed and so incredibly grateful to you all, not just for your time today, but for everything that you do for the interns. You're amazing and all day. So I can't wait to see actually what happens where they get their jobs. But thank you for sparing the time today, because this is going to really help lots of our other sites. So thank you, a massive thank you, and wishing you all a very happy long end week. And I'd love an update on how it goes reintegrating these interns back into Northwick Park.
It's exciting.
It is very exciting. Not sure who's more excited, us or the interns.
Yes, I can imagine.
Yeah, you are. I know. I can see it. Thank you so much.
Okay, then. Bye, everyone.
Thank you. Bye.